7 stroke warning signs you must know. Few things in life are scarier than the idea of a stroke. Imagine you're just going about your everyday business when you suddenly feel a sensation you've never felt before. In many cases, these sensations make it very difficult for you to get help, as if you've lost control over your body. That's the reality for over 100,000 older Americans each year. Fortunately, there are some specific signs you can look out for to keep a stroke from sneaking up on you. Let's get started. Don't forget to subscribe to our channel for all sorts of tips and information to keep you healthy, vibrant, and living your best life. What is a stroke? A stroke occurs when the blood supply to part of the brain is severely reduced or interrupted altogether. This basically deprives your brain tissue of the oxygen and nutrients it needs to function properly. A stroke is an emergency situation because your brain cells are literally dying with every minute that goes by. And here's the really scary part. The risk of having a stroke doubles every 10 years after the age of 55, and approximately 75% of strokes occur in people aged 65 or older. This is mainly due to age-related changes in blood vessels and a higher prevalence of risk factors like high blood pressure and diabetes. The good news? You can learn to identify the signs of an impending stroke before it even happens. Let's start with one of the most common signs of all. Number 1, facial drooping. We make millions of facial movements a day, and we rarely think about how much work goes into making them happen. You see, our facial muscles all rely on instructions from the brain passed through what's called the facial nerve. When something gets in the way of the process, those facial muscles don't work so well. In the case of an oncoming stroke, typically, one side of the face is affected while the other is not. This can cause noticeable drooping or sagging. To the patient, it might feel like they just had some dental work done, and the Novocaine hasn't worn off. In fact, the condition may also be accompanied by difficult swallowing. Either way, any drooping is a sure sign that it's time to call 911. Number 2, sudden dizziness or balance issues. Everyone knows the feeling of being dizzy. However, when there isn't a clear reason to feel this way, sudden dizziness can be a big warning sign, especially if it's combined with balance problems. When dizziness comes on out of nowhere, it can indicate reduced blood flow to the brain, particularly to the cerebellum, the part of the brain responsible for balance and coordination. Since the cerebellum helps the body maintain equilibrium, any disruption to its function can make you feel disoriented or unsteady. This could be a sign of an impending stroke, and it's worth taking a trip to the hospital just to rule out the possibility. 3, severe, unexplained headaches. Headaches are a common nuisance. Normally, we simply pop an ibuprofen and go on about our day. But in stroke-related headaches, the pain is not only severe, but it seems to come on out of nowhere. While the brain itself doesn't feel pain, the structures surrounding it can. When experiencing a sudden rupture or a blood vessel issue, you might experience a severe, unexplained pain that many stroke victims describe as the worst headache of their life. Obviously, anyone over 55 should know that any sort of severe pain is a clear sign that it's time to seek help. 4, speech and vision issues. Vision and speech are complex processes that rely heavily on clear communication between the brain and hundreds of different parts of the body. When blood flow is reduced to those parts of the brain controlling the eyes, it can lead to blurred vision, double vision, or even partial blindness. The same goes for speech. When blood flow to these areas is interrupted, speaking can become extremely difficult. Words might not come out right, or sentences may be difficult to form. In some cases, you might think you're saying one thing and end up saying something completely different. Either instance should be taken as a major warning sign. 5. Behavioral changes and confusion. Your brain controls pretty much every process in your body. When it is deprived of the blood and nutrients it needs to function properly, It could result in sudden confusion, operational issues, or unexpected changes in mood. Many stroke patients report being irritable, apathetic, or aggressive for no reason at all. They also claim they are unable to do simple tasks and can't seem to manage their behavior. Don't dismiss these as getting up on the wrong side of the bed. They're serious signs of a potential stroke. 6. Numbness, weakness, or fatigue. If you suddenly feel numbness or weakness on one side of your body, especially in your arms or legs, this could indicate a disruption in these regions of one or more lobes in the brain. In fact, numbness and weakness are two of the most common symptoms associated with stroke. The same goes for fatigue. After all, the lack of blood flow to the brain means fewer nutrients, which can make even lifting your arm feel like climbing a mountain. 7. Difficulty walking. Walking has been like second nature to most of us since age 2, so suddenly being unable to walk properly should stick out as a major red flag. When specific regions of the brain are deprived of blood, you can become unsteady or find yourself stumbling over your feet. If you notice difficulty walking, it's important to call for help immediately, while keeping out for any of the other symptoms on this list. The harsh truth is that stroke is one of the leading causes of long-term disability among older adults. In fact, nearly half of stroke survivors over age 65 experience moderate to severe impairments. But by recognizing these early warning signs, you can seek medical attention much earlier, which can significantly improve your outcome. Remember, if something feels off, get to a hospital. Our brains have ways of signaling we're in trouble. Don't ignore them. Please don't forget to click the like button and subscribe to our channel if you enjoyed this video. We are constantly putting out fun videos on everything related to wellness. Please remember, this video is meant for educational purposes and is not medical advice.